Dr. Vindhya Persaud is encouraging that Ghana learns from the experience of other countries around the world affected by the novel coronavirus or COVID-19 and implement measures to reduce the risk of the disease spreading. Dr. Persaud, who is the president of the Guyana Hindu DharmicSabha and a former opposition parliamentarian, noted that there are simple things that can be put in place, and it starts with information. More importantly, Dr. Persaud said the information on the disease needs to be from credible sources and available daily. Dr. Persaud also explained that persons need to know what to expect if they are going to be quarantined and be prepared.
I think that governments around the world are putting very practical measures in places, many with more cases of coronavirus than us, many with more deaths. Regionally, if we look at what some of the other countries are doing, we are seeing the full disclosure of information, and that's where it starts. Information is key, because if people are in receipt of solid, credible information from the health authorities, I think it will go a long way in terms of letting them realize that the COVID-19 virus is here and how serious and how potentially dangerous it is.
She said strategic measures need to be put in place for food, education, and access to healthcare in an environment that is constrained. As it relates to businesses, Dr. Persaud said there should only be essential staff working and guidelines need to be implemented about where people can visit.
People want to see and hear from their doctors. People need to see this in a medical health light. And I think this is where it needs to start. We need to be bombarded wherever we are with guidelines and information. Yes, we're told to hand wash. Yes, we're told to avoid close contact. Yes, we're told to socially distance, but the reality is that not everyone will do it. So measures have to be taken in public institutions as well. If you go around the country, you're seeing business as usual. So those measures need to be put in place. Avoid crowding. Only have essential services, maybe have fewer staff in place, non-essential staff put in place. Implement things like sanitizers at various places. Don't encourage grouping and congregations, and this needs to be a widespread message across the country, no matter where people are and who they are. Also, public transportation, that's very widely used in Guyana. What are the messages on that? Who's telling people what to do, what not to do, what measures to take when you use public transportations? What are the areas that you should or should not be going to? People are going to the markets. I understand that businesses need to survive. I understand that very well. But then there also needs to be a hand-in-hand plan with, when you put all of these measures in place, what concessions are you going to give those people who need to survive?
Cognizant of persons out there who do not believe that the disease is in Guyana and are not taking the necessary precautions, Dr. Persaud said it is essential to get to the root cause of why these people believe so. Dr. Persaud said ministries, groups, and organizations need to come together and approach the disease from a business, social, and health standpoint. Reporting for the newsroom, I am Isanella Patwo.